Thank you, Mr. Speaker. Mr. Speaker, this week the House is considering a number of bills relating to the opioid public health epidemic. I serve on the Energy and Commerce Committee, and over the past year, our committee has heard from experts. We've had numerous hearings on all facets of the opioid crisis. We've gathered facts, listened to witnesses, including those struggling with addiction, from doctors and providers, from the Drug Enforcement Agency, and more. Plus, many families and experts back home have informed us and encouraged the Congress to act. Last year, one loving father in my home district in Tampa, Florida, came to meet with me to share his experience. He said, "Our son has been an addict for the last 5 years. And during that time, our family has discovered how impotent the healthcare system, government, insurance companies, criminal justice system, and our family has been to combat this disease. Prior to our personal experience, we were likely, like most Americans, who believed this was not our problem, but we were saddened by those who experienced the crisis. In addition, we cannot believe how futile and limited our resources and efforts to help our son overcome this illness have been. We still believe, although to a lesser degree, that the people afflicted with this illness still hold the key to unlocking their own happiness, to managing this illness. However, what is abundantly clear now is the resources necessary to provide even a remote chance for addicts to achieve temporary or permanent remission must be substantially increased. We have invested personally over $100,000 trying to help our son." His remarks echo what we heard from experts all across the board in our committee, like Dr. Andrew Caldney, the Director of Opioid Policy Research at Brandeis University, who emphasized that treatment has got to be expanded exponentially, and it must be easy to access. We have to build a new system in America that does not exist. Now, Democrats, we have urged our colleagues on the other side of the aisle to join us in truly tackling the crisis. And what became apparent in committee and what is apparent through this small ball of bills on the floor this week and next week is that Republicans still are not there. They're not willing to adequately address this public health crisis because we need a robust, long-term solution that truly meets the challenge of the opioid crisis. A consensus has emerged, and it's based upon these devastating facts right now. Over 40,000 people are dying from an opioid overdose every year. In my home state of Florida, we are losing about 5,700 people per year to overdose. That was in 2016. That was a 35% increase from the previous year. And CDC says opioid overdoses have quadrupled since 1999. Only 10 to 15% of Americans suffering from opioid addiction are currently receiving treatment. Those numbers cry out for a meaningful, comprehensive approach, but our Republican colleagues have failed to get there with us. Now, we have been through this before. In the late 1980s and early 1990s, we were struggling with the HIV/AIDS public health epidemic. And for many years, the Congress was criticized for not adequately addressing the crisis. There was a harmful stigma involved, just like there is for opioid addiction. But by the 1990s, the early 1990s, the Congress came together and adopted the Ryan White CARE Act that provided resources all across the country in a consistent fashion, provided funds to states and local communities and nonprofits to help us. And now the death rate from HIV/AIDS is dramatically less. And this is what we have to do when it comes to opioids, provide that comprehensive long-term solution that simply isn't being demonstrated in the small ball, these little bills. They're simply nibbling around the edges. And Mr. Speaker, it is very difficult at the same time to be proactive in a meaningful way on the opioid crisis when Republicans and the White House continue to drag us backwards when it comes to affordable health care. Just last week, the Trump administration and the GOP launched another attack, a new attack on Americans with pre-existing conditions, like opioid addiction. They asked a federal court to strike down the Affordable Care Act's pre-existing condition protection. That is the bedrock protection contained in the Affordable Care Act that says if you have a cancer diagnosis, Alzheimer's, heart disease, an insurance company cannot deny you coverage, and they cannot charge you exorbitant rates.
Time has expired.
The GOP has never really been for that protection. How are we going to adequately address the opioid addiction crisis when they want to tear away affordable health care, including protection on pre-existing conditions?
Time has expired.
We need a robust solution here.